I'm Betsey O'Donnell. I'm a medical oncologist in the MGH Cancer Center, and I'm the director of lifestyle medicine. Lifestyle medicine is the use of behavioral activities such as diet and exercise, physical activity into your medical care. Specifically within oncology, it's the use of things like exercise, strength training to improve physical functioning and hopefully improve quality of life. The Lifestyle Medicine program at MGH is a clinic that is devoted to addressing the wellness needs of our patients as they're going through or recovering from cancer therapy. It's open to any patient who's had a history of cancer or is undergoing treatment for cancer. And during this one-on-one visit, we take a thorough history and understand what the patient's specific needs are in terms of physical functioning, diet, weight control, and nutrition. It's an hour-long, one-time session with me as the medical provider. Very often it will culminate in patients being referred to physical therapy or to conditioning programs that exist here at the hospital or outside of the hospital that are available to cancer survivors in the community, so that patients are made aware of the resources that are available to them and the appropriate resources are allocated to the patients who need them. This is a clinic for cancer patients who are either in cancer therapy or beyond cancer therapy and wanting to get back to living the way they see themselves wanting to be, whether that's better than how they started or just getting back to who they were and meeting their goals for thriving, not just surviving. So patients who would come to me would be interested in talking about ways in which they could recondition after chemotherapy. As we know, cancer chemotherapy and other treatments can change the way your body looks. You can gain weight, lose muscle. You may not feel well, so you don't exercise as much, or maybe you never exercised to begin with, and now you want to feel better. And this is a means by which we can give personalized, customized recommendations for individuals looking to recover physical function and wellness during and after cancer treatment. So a typical visit will include a needs assessment where we look at patients' current level of physical functioning, their interest and willingness to adapt new lifestyle behavior changes, and we'll do a comprehensive evaluation of their current behavioral patterns around lifestyle so that we can address where there are needs and address those needs. We know that cancer therapy affects people's physical functionality. People lose lean muscle, they gain weight, they see changes in their bodies, they feel changes in their self-esteem. So this is a direct means at which we can address those changes that occur and help patients get back to being the person they were or the person they want to be. For better or for worse, a cancer diagnosis is also an opportunity in life to make changes. We'd like to use this clinic as a way to help patients make changes for the better. There are data in certain diseases, specifically breast cancer and colon cancer, that physical activity level, body mass index are important predictors and modifiable risk factors for patient outcomes. So not only do we know that lifestyle medicine can improve quality of life, but it may also improve cancer outcomes for patients. So the goal of this clinic is really twofold. One, to address quality of life issues, but hopefully to introduce interventions that can be of benefit to patients' overall prognosis and cancer outcome. I did a survey of our myeloma population, and 87% of patients said they would want physical therapy if it were offered to them. And so this was the impetus for me to really start to evaluate what resources we had at our hospital. I think MGH is uniquely poised to provide services that other cancer centers may not, because we are a general hospital, because we have so many different doctors in different disease groups who are interested in this field and working in this field. We have the ability to offer people things through our general hospital that might actually help their cancer outcomes. So for me, how I personally got involved with this was my own initiative, talking to other doctors, talking to other providers, and realizing that we had a unique opportunity to give our cancer patients something different that's not being offered elsewhere. This is a medical visit billed as a consultation. So patients can contact the Cancer Center at 617-724-4000. I have an access nurse who can facilitate appointments both here in Boston and in our MG West clinic in Waltham.